Are you tired of using over-the-counter eye drops or artificial tears multiple times a day, and your eyes still feel burning, stinging, and red? Well, that's what we're going to talk about today. Hi, I'm Dr. Ayesha Butt. Welcome to our YouTube channel. A lot of my patients tell me my eyes just feel dry. I use artificial tears, but they don't really fix it. And that's exactly why this conversation is so important. Dry eye happens when the tear film, the thin layer of moisture that coats the surface of your eye, becomes unstable. Either you're not producing enough tears, your tears are evaporating too quickly, or the quality of your tears is poor. Now let's talk about symptoms, because many people don't realize that their complaints are actually dry eye related. Patients often describe burning, stinging, or gritty sensation like sand in their eyes. Some say their eyes water excessively, which surprises them that it's dry eyes. But reflex tearing happens when the eye is irritated, and those tears are mostly water, not the balanced tears you need. Others report blurry vision that fluctuates throughout the day, especially on the computer. Light sensitivity, redness, heavy eyelids, eye fatigue, and contact lens intolerance are also very common. And here's something very important. Dry eye is progressive if not treated properly. To understand why artificial tears are not enough, we need to understand 3 layers of the tear film. The outermost layer is the lipid layer. This oily layer is produced by the Meibomian glands in your eyelids. Its job is to prevent tears from evaporating too quickly. The middle layer is the aqueous layer. This is the watery portion made by the lacrimal glands. It provides hydration, oxygen, and nutrients. The innermost layer is the mucin layer. This helps tears spread evenly across the surface of the eye. If any one of these layers is dysfunctional, the entire system becomes unstable. Most dry eye today is evaporative dry eye caused by Meibomian gland dysfunction, meaning the oil glands are blocked or inflamed. So if you're just adding artificial tears, which mostly replaces the water layer, you're not fixing the root cause of dry eyes. That's why we do a comprehensive evaluation in our office. First, we take a detailed history. I ask about screen time, contact lens wear, autoimmune conditions, medications, hormonal changes, prior LASIK surgery, skin conditions like rosacea or acne, and systemic inflammatory diseases. Many medications such as antihistamines, antidepressants, and even acne medications like Accutane can worsen dry eye symptoms. Then we perform diagnostic testing. This may include tear breakup time to measure how quickly the tear film evaporates. We may check corneal staining with special dyes to look for surface damage. Shimmer testing measures tear production. Meibomian gland imaging allows us to actually see where the glands are blocked, shortened, or atrophied. We evaluate lid margins for inflammation, debris, and signs of blepharitis or Demodex infestation. Dry eye is a diagnosis that requires identifying the type and the severity. Treatment should be very personalized. So now, let's talk about why artificial tears alone are usually not enough. Artificial tears can temporarily supplement moisture. They're supportive therapy, but they do not treat inflammation. They do not unclog Meibomian glands. They do not correct underlying autoimmune or hormonal contributions, and they certainly do not reverse gland damage. So what does real treatment look like? First, lid hygiene is fundamental. This includes warm compresses, lid scrubs, and specific cleansers to reduce bacterial growth and biofilm along the lid margin. In cases of Demodex mites, we may recommend tea tree-based cleansers or prescription treatments such as Xdemvy. We have to treat Meibomian gland dysfunction. This is where in-office procedures become extremely important. Thermal pulsation, radiofrequency, and intense pulse light or IPL can help melt thickened oil, reduce inflammation, and restore gland function. Here's where it gets interesting. Many patients with Meibomian gland dysfunction also have underlying inflammatory skin conditions like rosacea or acne. These inflammatory conditions increase abnormal blood vessels along the eyelid margin. These vessels release inflammatory mediators that further damage the meibomian glands. This creates a vicious cycle. Inflammation leads to gland dysfunction, which leads to more tear instability, which leads to more inflammation. Intense pulse light, or IPL for short, works by targeting those abnormal blood vessels and reducing the inflammatory load around the eyelids. It also decreases bacterial overgrowth and Demodex mites, both of which contribute to chronic blepharitis. For darker skin types where we can't do IPL, we tend to use red light therapy or low-level light therapy. Radiofrequency, on the other hand, uses controlled heat to safely warm the deeper layers of the eyelid. This melts thickened oils inside blocked glands and allows them to express more normally. It also stimulates collagen remodeling, improves lid margin structure and function. So there is huge cosmetic advantage to radiofrequency and IPL because it makes the skin look younger, firmer, and removes leaky blood vessels and brown age spots. When we combine IPL and radiofrequency, we're not just lubricating the surface, we're treating the underlying inflammatory driver of your evaporative dry eyes. Patients with rosacea, acne, chronic red eyelids, stye, chalazion, and those red bumps on the eyes, and recurrent gland blockage often see significant improvement when inflammation is addressed at this level. Second, we address inflammation at the ocular surface level. Prescription eye drops such as cyclosporin in Restasis or lifitegrast in Xiidra work by calming the immune response on the ocular surface. Short courses of mild steroids may be used in more severe flares. However, it is important to focus on the lids as 89% of the dry eyes are evaporative in nature. This is why a lot of patients get little to no improvement with expensive prescription eye drops. I also use Tyrvaya nasal spray to improve basal tear production. Oral omega-3 fatty acids to improve quality of meibomian gland secretions in certain patients also helps. We individualize recommendations based on your overall health. For more advanced cases, we may consider punctal plugs to slow tear drainage and keep natural tears on the surface longer. In severe ocular surface disease, amniotic membranes can help heal the damaged tissue. And for patients who need all-day relief, especially those with significant corneal damage, corneal transplants, or conditions such as keratoconus, scleral lenses can act as a fluid reservoir over the eye, providing both protection and consistent hydration throughout the day. The key message here is this: dry eye is not just dryness, it is chronic inflammatory condition that requires a comprehensive approach. If you are using artificial tears 4, 5, or 6 times a day and still uncomfortable, that is your sign that you need a full dry eye evaluation. The earlier we diagnose and treat the root cause, the better the long-term outcome. Because once meibomian gland atrophy, they do not grow back. Dry eye management is about restoring tear film balance, reducing inflammation, protecting the ocular surface, and preserving gland health for the future. If this sounds like what you are experiencing, schedule a dedicated dry eye consultation today. Don't just keep buying more artificial tears. Let's figure out what type of dry eyes you have and create a plan that actually works for you.